Right, good evening, everybody. This is our Tuesday team training, and we call it Applied Neo Life because we try to put our business and our products into context. So I've been requested to revisit this particular topic on fibroids. I've tweaked it a little bit and said fibroids and hormones. Well, the question is, how can fibroids best be prevented? And that's what I want us to consider. And during this presentation, I'll start by introducing myself and my husband, Dr. Nambasi, who happens to be, for the many, many years, in fact, I met him, many people laugh, but I met him when I was during my undergraduate in a labor ward. He is one of the best obstetricians I've ever come across. And I can say that with confidence because he delivered our 3 children. We are the proud parents of 3 amazing children. And so I thought I would introduce him because he spent a long time dealing with issues of childbirth and women's health and gynecological issues such as fibroids. And so between the 2 of us, we have committed ourselves to healthier families. And so we are on a mission to make the world healthier and happier as part of the bigger family called Neolife. If there are any guests here, you're most welcome. I hope you will come with us on the mission that we are on. What are fibroids? One would like to ask that question. What are fibroids? Let me see if I can start my video. Okay, and I'll just, okay, I think we're ready to go. Well, fibroids are said to be benign, which means they're not malignant, they're not cancerous. They're benign, smooth muscle tumors of the uterus. They go also by these other names, leiomyoma or myoma for short. And importantly, they're thought to be triggered by estrogen. You see, estrogen is a growth-like hormone. It stimulates growth. And so there is a heavy hormonal component to the causation of fibroids. And so this picture just shows you what they look like. They are smooth muscle tumors, and they can be either subserosal under the outer layer of the uterus, submucosal under the inner layer where the actual cavity is, or they can be intramural inside the wall, the actual muscle of the uterus. And the associated risks are many. We shall discuss them now. And may I warn you that if you do not mute, I will evict you from the meeting, okay? If you unmute, I will throw you out this time. And that ruins my recording, which is running now. Right, associated risks include age, the environment.
Mom, how do they put that music for TikTok?
The environment, just a minute, please. Okay, age, the environment, stress is a big factor, the diet, vitamin D deficiency, and then of course the reproductive history and ethnicity. We've seen that fibroids affect an estimate of 70 to 80% of women by the age of 50 have fibroids. But also, it is more common in women during their reproductive years, the 30s and 40s. Maybe they might start even in the 20s. And the other factor, when I mentioned ethnicity, more common in Black women, about 25% will have fibroids by the age of 30. Small ones start small and then they grow, as compared to 67% among the Asians and Caucasians. So the symptoms most associated are abnormal uterine bleeding. You may find a lady has heavy and sometimes irregular periods, and they might be bulk symptoms felt as pelvic pressure, bloating. They might be urinary symptoms, frequency or recurrent urinary tract infections. A common one is constipation, or they might be pain, particularly if there's low blood supply to those tumors. They might manifest as pain. And yes, because of the bleeding, anemia is common. So how do we diagnose them? Well, it's important to take a good history. And that is facilitated when there is a good rapport between the patient and the doctor. Unfortunately, many times to develop that good rapport can take a long, long time. And it might be so long that a physical assessment of the patient might not happen, a proper physical assessment. And then other things like the lab might confirm anemia, especially if there is heavy menstrual bleeding. And then one can use technology, ultrasound scans and MRIs and things like that. But the key here is to take a good history from the patient. And it's not uncommon to find even young girls these days looking something like that, right? But as we go through the rest of the presentation, we might have to think carefully whether lifestyle is causing this hidden challenge of fibroids. So that's the purpose of this presentation, to get us to think. Now, one of the commonest complaints about fibroids is infertility. But fibroids might be the only reason for that infertility. And a lot of women have allowed themselves to have an operation called myomectomy, which means removal of those leiomyomas that we've talked about and shown in the pictures, the tumors. Some are successful, some are not so successful. So that is one way of doing it. And that's why I want us to consider prevention and really focus on prevention. Now, depending on where fibroids are situated, distortion of the uterine cavity may lead to higher rates of miscarriage and or even reduced implantation rates, either naturally or even in vitro fertilization, implantation of the fetus. So that's something to consider. How fibroids affect fertility, I've mentioned it, distorts the cavity. They impact the uterine lining and therefore stop implantation. It's almost like the principle of having a foreign body there. That is how an intrauterine contraceptive device works, all right? It will stop implantation. And then there's also decrease in blood flow. And if they're situated where the fallopian tubes leave the uterus, the uterine cavity, they may actually block that. And here's a picture to just show what we are talking about. Right, and so as regards fibroids and pregnancy itself, yes, pregnancy can happen despite fibroids. It just might be harder to take place or to happen. But fibroids can increase in size during pregnancy, but subsequent to the pregnancy, after pregnancy, most of them reduce back to a smaller size. However, in 10 to 40%, they can cause complications in pregnancy, such as pain, preterm labor, malpresentation, placental complications such as abruptio. Abruptio is when the placenta separates from the uterus and may bleed behind itself. And that can cause a lot of challenges. And then, of course, at cesarean section, it might be problematic. And then I've talked about hemorrhage due to abruptio placentae, but postpartum hemorrhage, where the uterus does not contract sufficiently to stop that bleeding. So those are complications should pregnancy occur or happen. Happen is a happier word to use. Okay, so reasons for late diagnosis. I've said that if there is no good rapport between the patient and the doctor, it is often a missed diagnosis. But here are other reasons: no symptoms or lack of awareness by the patient. In other words, that patient has actually accepted her symptoms as her normal. And then, of course, complexity of that part of the body, that part of the anatomy. Few patients will readily accept an assessment, but there's a caveat to that. Few doctors have time to even consider. So maybe that's a smack on the wrist for our profession, where we are in such a hurry, especially in the public service, to go through a long queue that you forget to take the time. And not everybody can go to private. Okay, so just think about this. There was a survey that was done of 1,000 women. The average time to seek treatment was about 3.5 years. Okay, here they are, symptomatic, heavy periods, pain, even anemia, but they took over 3 years to seek treatment. And then in 32% of the women, it was even longer, over 5 years. And 42% of the women had seen 2 or more healthcare providers before the diagnosis of fibroids and associated complications was made. So that is actually quite scary, in my opinion, considering that they are common. So I'm hoping that we can think about them more. But right now, we want to look at ways to prevent them. And prevention will mean that we focus on the younger girls and not deal so much with the older people, but actually focus on our young people. So let's carry on. For the African woman, fibroids have quite an adverse impact. They impact work or school. They may cause anxiety about heavy bleeds. The effects of chronic fatigue due to anemia may lead to self-esteem issues. And in this day and age where women are expected to work as hard as men, that might create a problem, okay? So I just want you to have a broader picture and consider even the psychosocial issues that fibroids might create. And then the more symptoms in African women, they tend to be larger and more numerous. And if diagnosed and operation is suggested, this might lead to another sort of stress, in that very often financially or lack of good resources from the hospital may create a situation where the outcome is not favorable. So let's think broadly and really think prevention. And for that, let us consider lifestyle and the factors that can be controlled. Let us learn to control the controllables. So I'll start with the diet. Is it important to take a closer look at diet as a root cause? Yeah. And can we influence hormones and therefore fibroids? I believe so, because it has been shown and said several times that food indeed matters, because too much meat in the diet is associated with an increased risk of fibroids. And commercially reared animals are given a lot of antibiotics, they're given a lot of hormones, and those hormones in the food chain will affect the woman's hormones as well, or the girl's hormones. So plant-based diet it can be protective, and we have what we call phytoestrogens, plant-based estrogens. They have a protective role in that they bind excess estrogens that might be made in the body or taken in from the environment, from chemicals like pesticides, from plastics, from petroleum products. And those xenoestrogens and endogenous estrogens that might be circulating in the body can be protected by phytoestrogens from plants, okay? And there are many things like legumes, beans, soya is one that we know very well. Fruits and vegetables, different ones. The citrus fruits have phytoestrogens, and then we have things like yams, which also are important. Protein made in the body holds this combination of phytoestrogen and estrogen, the excess estrogen. And the result of that is that it enables the body to get rid of it. It is exported to the liver and excreted, okay? So this reduces the amount of estrogen available, phytoestrogens that we've mentioned, reduce the amount of estrogen available to negatively affect estrogen sensitive tissues, such as the uterus. There are other estrogen sensitive tissues, like the breasts, for the men, the prostate, and ovaries, and colon, as well as lung. Yeah, so we don't want too much estrogen floating around. After it's done its work, it has to be disposed of. So these are the foods that we should be eating plenty of. However, modern lifestyle sometimes gets us into all sorts of trouble where we can rationalize and, I suppose, make excuses that we don't have the time. So phytonutrients and phytoestrogen containing plants, we have to eat more of them, eat more fruits and vegetables, because they will protect you. And also for menopausal symptoms, okay, very important. So I've just put a lot of pictures so that you see how serious it is for us to get back to the basics of the right food and not make excuses and not go for fast foods. So let's talk about balance of sex hormones. Sex hormones, when we talk about it, when we talk about them, we're talking about progesterone and estrogen. And specifically because we are talking about fibroids today, we are referring to women. But there's also testosterone, which is another sex hormone. It is in both male and female, as are progesterone and estrogen in both male and female. Now, estrogen dominance is becoming rife. It is all over the place, and it is associated with fibroids, as it is with ovarian cysts and endometriosis, and also the premenstrual syndrome that we like to call PMS. So let us be very mindful . Okay. Please remain muted. Okay, so let me just see whether I may have missed a slide. Okay, that's what we were talking about. Right, so early signs of estrogen dominance in the female, but it can happen in the men as well. But in the female, severe premenstrual syndrome, which is associated sorry, let me just now go back to the slide. Oh gosh, this is going to be a dreadful recording because of all the interruptions. Right, estrogen dominance. Sorry, I was talking about these symptoms, sorry about that. Sweet cravings. Have you seen that we have mentioned on several occasions that sweets are addictive, or sugar is addictive, and craving of sugar can cause quite a few challenges generally. And so other things that can happen: heavy periods, weight gain, breast swelling, and water retention. Now, a lot of people have these symptoms and they have become their normal. They have become so used to them that they think it is normal. Okay. Right. Okay, let's carry on. Causes of estrogen dominance: excessive exposure to xenoestrogen. Xenoestrogens can be found in your washing powder, in petroleum products, in skincare products. Progesterone deficiency. We're talking about the sex hormones, and we've talked about the estrogen and progesterone. Now, if there is a deficiency and the balance is out of order, then estrogen will be apparently dominant, or a combination of both. So again, I want to emphasize the value of good food and hormone health and weight management, the seven keys that you always have to remember. Regular exercise, adequate nutritious food, get sunlight in the first part of the day. Please switch off electronics. So as soon as we are done with this, we'll switch off. Proactively bring down chronic stress, because cortisol, one of the stress hormones, can deplete or displace progesterone and result in estrogen dominance. And that's why we see a lot of stressed people putting on weight, particularly in their middle, because of that imbalance. And then get enough sleep. It is so important. And then we are going to discuss the importance of ditching toxic chemicals. So why it is important to maintain healthy weight? It has been shown time and again that obesity is associated with greatly elevated levels of estrogen, and gaining more than 10 kilos over what you're supposed to have has been shown to be associated with increased risk of fibroids. So when we talk about maintaining and the importance of maintaining a healthy weight, There are many reasons, but here is yet another one: to prevent fibroids if we can, and we should focus on our young girls at this stage. So the role of vitamin D, I just wanted to highlight that. A study showed that women with fibroids were found to have lower levels of vitamin D compared to control women without fibroids. And people, those of us on the Africa continent with darker skins, are up to 10 times more likely to have low vitamin D levels. So don't be fooled just because we have a lot of sunshine. We do need to make sure that we do something about our vitamin D levels. And the conclusion to that is that vitamin D deficiency may be one of the factors associated with fibroids. It may even stimulate it. And obese and overweight people are inherently vitamin D deficient, as they are vitamin A as well. So all these interesting linkages are something to think about. So back to controlling the controllables. Keep animal fats very low in the diet. Choose organic fruits and vegetables and meat, if possible. Unfortunately, those of us who live in urban areas, sometimes we can't do anything about that. We eat what we are given in the supermarket. Avoid fatty foods that are wrapped in plastic, or those cling wraps and plastic packages. That causes a lot of hormonal disrupting effects. Reduce or stop stimulants, and by that I mean sugar, coffee, chocolate, tea. Reduce them. Sometimes we go over the top and overdo them, but if we reduce them, particularly in the younger girls, we might save them getting fibroids. Then manage stress. Learn techniques to manage stress. Do something that is suitable for you, but please manage stress. And I've mentioned it in on many occasions that some people do the wrong types of exercises that are very, very stressful. Their cortisol levels go up, and that will set up a cascade of hormonal imbalance. So we are about to turn our attention to supplements, essential fatty acids and essential vitamins. We are going to talk about herbal supplements for progesterone balance that we happen to have in our family, and also the fact that it is important to eliminate xenoestrogens from your home and your personal care products. So what changes we can make? And this is where we want to share with our guests that we do have solutions. But the key is to have a long-range vision. You don't come here expecting a quick fix, and you don't think that this is medication that is going to take the fibroids away. Once fibroids have developed, it might be necessary even to have them looked at surgically. But let us discuss prevention. And so I want us to talk about lifestyle choices. This is important, and we've mentioned it. Exercise, healthy food, rest, we've talked about that. I want to talk about what Neolife has said for years, the family that we are in. Weight management plus physical activity plus a diet rich in whole food nutrients, which are found in whole grains, fruits and vegetables, and fish. And that's precisely what we get when we are given a pack that we are about to see called Pro Vitality. But let me start by talking about eliminating hormone disrupting chemicals. That is a choice that each and everybody can make. And that is the privilege we have in this family, to have products that we can compare with others sold elsewhere, and ours will beat those products hands down any day of the week, because they're economical, they're non-toxic, they're 100% biodegradable, They're very, very effective. They're totally versatile. You don't have to have a whole row of different chemicals in your house. You can eliminate hormone disrupting chemicals. And as you do that, you save the earth because they're earth friendly. Then skin care also matters a great deal. So I know this is one of those things that people will cling to with everything they've got. Tradition really gets in the way on what people use on their skin. But remember, the skin absorbs tremendously, and you might just be setting your own children up by using a known brand, which might be sourced from petroleum. You know, it might be called a certain petroleum jelly. You might be actually smearing on their skin on a regular basis a hormone disrupting chemical that will ultimately in the future lead to fibroids. That's not fair on the little ones. And then we have core nutrition. The core nutrition supplies the foundation on which to acquire optimal health. However, to balance hormones and manage inflammation, you do need to consider additional supplements. So that's what our core nutrition looks like. And with it, it has the protein, the amino acids. And you will remember a few slides ago, I said that the phytoestrogens and the excess estrogens form a complex that has to be bound by protein to be transported out of the system. That's why it is important to have all the amino acids that our Neolife Shake supplies so that the body can make those proteins, the globulins that are required for transportation. Then I mentioned the essential fatty acids. Most people are totally deficient of omega-3 fatty acids. They have too much of the inflammatory ones. Omega-3 is broad spectrum. It brings inflammation to an end. It brings down the inflammatory index quite remarkably, and fibroids is a form of chronic inflammation that is allowed to simmer on for a long time. And then, of course, it is complete. You won't find a more complete omega. It has all the 8 omega-3 fatty acids that are involved in our nutrition. So it's important to consider. Right, then let's talk about this particular chelated CalMag mineral. It contains vitamin D. That's the point I wanted to mention, the fact that it has vitamin D in it. And then cruciferous, the fact that it balances hormones. And now we need to go further and talk about the feminine herbal complex. All right, we've talked about the fact that a lot of these things that we see, such as premenstrual syndrome, the discomfort, the cramping, the fluid retention, the bloating, those may be early signs, the severe PMS may be early signs of a future of fibroids, okay? So we can use this to rebalance. It's an adaptogen called feminine herbal complex. It looks like that. It will rebalance the estrogen to progesterone balance. And that goes some way to addressing that problem of estrogen dominance. So that is our presentation. I'll stop sharing and I will invite you to discuss.